I'm agreeing with you, but I'm learning all this. This is,
Okay.
people don't understand this. And that's why I'm so glad we're talking about this. Thanks so much for tuning in to Second Act TV. Today I'm so happy to welcome back sexual health advocate and the CEO and founder of Lumisk Skincare, Lana Kerr. Lana, thanks so much for joining us again.
Oh, it's such a wonderful pleasure to be here with you, Silka, and to be a part of this. So thanks again for inviting me onto your platform.
I'm so glad you're here. We did a segment a couple of weeks ago that was very, very well received. Because it's such an important quality of life topic that we don't talk about much. We're hesitant to discuss, and that being female sexual health and then what happens to us as we age, again, in particular, painful sex that we start developing during menopause. And on our last segment, we discussed what happens. Why does that happen? Well, it's the loss of estrogen and the thinning of the vaginal walls. Let me read a couple of the comments that I found were interesting in the questions. Here, love to know how we repair our vaginal walls. I just had the most painful experience after having sex for the first time in 5 years. Okay, sounds familiar? Or I've been widowed for over a year and I'm entering the dating scene again after 40 years. What do I do to maintain vaginal health if I'm not having intercourse? And then I want to read one question from a man, and I'll preface that by saying we got fabulous input, questions, and comments from men, very supportive, also thanking us for bringing this up. Here's one, though, that kind of is reflective of general attitude out there, and that is, put an over 50 fitness instructor on your show. Her body is not breaking down. Things break down because of poor diet and lack of active lifestyle. Well,
let's talk about that one
yeah.
in this episode. Wow. As a person who, my background is in fitness and nutrition, and I'm very careful about what I put into my body. Down there, it's a different,
Right.
It's a different animal. So we'll definitely get into that.
Yeah, exactly. And that's the reason I bring that up is, not to do any shaming here. This is the attitude we face. It's like people don't understand that the loss of estrogen is the primary reason this is happening. And there's a lot of products or different treatments out there that are so confusing, again, first and foremost, because we don't talk about this. So the first go-to, of course, is your over-the-counter. Makes sense. Kind of like if you get a headache, you go get some aspirin until you figure out it's a migraine. And the first level of confusion, as it was to me, I had to learn this later in life, is the difference between a moisturizer and a lubricant.
So when you think about lubes, you're thinking about something that's going to help with glide. So if you're having penetrative sex and you want something to glide in, it's going to help to push it in and for it to go in smoothly. A moisturizer, and I'm a big advocate of moisturizers for the vulva. It keeps that area conditioned, right? If you think about a moisturizer for our face, it keeps it conditioned. Right. But again, as we age, the moisturizer doesn't have the same benefit for thinner skin as it does for when we're younger. So we need something more of a hydrator. So even in skincare, we talk about the difference with a hydrator and a moisturizer. So we need both, but certainly it's different with lube. So lube, you can still have lube and glide it and still have painful sex.
Yeah. But what popped in my mind right away is, the whole use it and lose it component that we discussed, and that was referenced in these comments too. It's like almost a chicken and the egg. One of the best ways to maintain vaginal health and the blood flow is through some sort of penetration. But you can't do that if you already have thin walls and damaged walls, if you will. So it's really about repairing, what repairs and reverses vaginal atrophy that we need to focus on. I think that's one of the points I want to make. And one of the ways to get there, and it's kind of your second level, is, hormones, estrogen, topical estrogen.
Oh, yeah, for sure. I mean, topical estrogen, and some women are afraid to take
Right.
estrogen because of predisposition towards cancer. But yes, if you take a topical estrogen, it's definitely going to condition back that skin again, because the same feelings are experienced not only in menopause or perimenopause or postmenopause, but even in postpartum women, when they're breastfeeding, they experience, because of the lack of that, they experience a little more dryness. So estrogen is definitely a solution for some women. I personally have never taken estrogen cream, but I know many women who have and have found definite benefit of it. But again, it's something that you're going to apply on a regular basis, and and long term. And I've heard of, and I was reading something because I'm writing this ebook on sexual enjoyment. I've heard from so many doctors that long term you don't want to have that as a solution. Long term, it's something that's going to help, but then you need to have something else.
Right.
That's going to be you replace that with for long term.
Yeah. And I'll talk personally. I mean, I had the bioidentical hormone therapy, which I'm a big advocate of. But again, it's not, you need something else to repair. The estrogen did help me, but it's like you said, it's 10 days. And after that, I became sexually active again. So I've done well since then. So that did help. What has come, maybe I've just noticed it more because I've been doing these topics now for the last 5 years or so. But vaginal rejuvenation, and that's one of the main things I want to focus on today, because people get very confused with that as well. So talk to me about these vaginal rejuvenation treatments and what they can and cannot do.
So first of all, I am a big advocate of bioidenticals myself. It's just that for me personally, mine estrogen is not a part of it. But let's talk about vulva vaginal rejuvenation. People think of surgery as vulva vaginal rejuvenation. That's really repairing something. So when I think of surgery, I think of you thinking of making that area prettier, for who has a particular look in mind that they want. It can help because sometimes the hood of the clitoris is covered and they may want to bring that back to expose it more, and that way she can get more sexual pleasure. But really it's something, it's not changing the skin, it's just the look of it, right?
I'm agreeing with you, but I'm learning all this. This is
okay.
People don't understand this, and that's why I'm so glad we're talking about this.
It's interesting because I've been to some of the meetings that I've gone to with a lot of the plastic surgeons who really change that area, vaginal reconstruction. That's a very popular surgery. Think about many years ago, before breast augmentations were popular. There was a time when doctors thought, who would come to me for breast augmentation? Then we know the boom of that market. Well, the vaginal reconstructive market is going to be even a bigger boom. More and more women are concerned with how that area looks, especially because they're removing all the hair, they're watching movies and they're seeing a look of what they think it should look like. So they want to model that look as well. So that's the surgery. But now when we talk about functionality of the vagina, that's where we're really more going into what I consider vulva vaginal rejuvenation. And then there are a wide range of things. I think one of the most popular, or maybe not popular because many people still don't know about it, energy-based devices. Energy-based devices, we think of our face and we use energy-based device to help that tissue to regenerate quicker. You're putting what you're doing, you're damaging the tissue so that the body will see that it's damaged and now force oxygen to start repairing that tissue. And so that's vaginal rejuvenation in terms of what people energy-based device. So you go into a doctor's office and you go in there and they can use heat, or they use laser, or they're using radio frequency, and now even microneedling. I don't know if most people know that happens in the face. And they needle inside the vagina. And there's usually some downtime, usually 5 to 10 days of downtime, because you can imagine you're putting trauma on that tissue.
It sounds painful.
Yes, it has a level of discomfort. They're going to numb you, so to kind of remove that. But that's one option that's available. And then the only other option that I know of is carboxy therapy. right?
Which
So
is what your product delivers, right?
yes,
Yeah.
CO2 lift V. So
Mm-hmm.
carboxy therapy is, think about the same thing. You're damaging the tissue so that oxygen-rich blood can be rushed into that area to start repairing it.
Mm-hmm.
Well, that's what CO carboxy therapy is doing. You're putting CO2, and though you're not damaging the tissue, the body responds as if it is being damaged, although there's no pain.
Okay.
Because when you put carbon dioxide into the tissue, the body is going to know it's a series of events are going to happen, but it's going to end with a lot of oxygen-rich blood in that area. So it's going to repair that tissue and build back the blood vessels in that area, thicken the skin so that you can know very quickly as well. It really is CO2 lift is really the fastest way to better skin, not only the face, but certainly in the vaginal area. So that you're doing that. And in carboxy therapy, you're going to do, maybe you'll do anywhere between 5 to 10 treatments. And when you get the results, you can maintain it with once a month. If you're doing laser or radio frequency, it's always sold in a series of 3. And oftentimes too, Silka, they pair it together. It actually works better. Combination therapy works better. So that if a woman decided to go into her doctor's office to do this, which is great, she can use this as well to heal that skin very quickly, as well as to get better results. And then by doing it on a monthly basis, she'll actually extend the life of her treatment that she received.
Yeah. Yeah. The logical question that comes to mind, what does all this cost? How viable is it for most women? I mean, can you give us an idea?
Yes. Well, for laser, radio free, energy-based devices, from what I understand, you're paying per treatment, you're paying anywhere between $600 to $2,500 a session. And you're going to need to have at least 3 or 4, right? For carboxy therapy, the 3 of the laser would be compared with 2 of the 5 count. So a box is $600, so $1,200 is for 2 boxes. So $1,200, or you're talking about anywhere between $1,200 versus on an average $3,000. So that's kind of the if you want to compare. And carboxy therapy, there's no pain, and you do it in the privacy of your home.
Yeah, yeah. When I hear you talking, that what comes to mind to me is like the cosmetic procedures, the laser, the fillers, Botox, that sort of thing. So you have to find, in that direction. And for some people, that's important. For some, it is not. It is, though. Again, it's such a quality of life issue that when we think about all the money we spend on ourselves doing other things, that this all of a sudden doesn't sound so bad.
That's my position on it, Silka. I mean, to me, sexual enjoyment is a must in a relationship. So why not enjoy it? And why not get the most out of it? Speaking and even looking at some of the comments from your readers or from your listeners, I saw that. I mean, in relationships, one gentleman expressed he was glad to hear this because in his relationship, his partner was not the same. She wasn't looking forward to having sex. Right. So to understand that it's not a reflection on him, but it may be something that she's experienced, it's a very natural thing. But guess what? There are things that you can do to prevent or reverse it. And that's what we're talking about here. Right. So I would definitely encourage a woman to check out any of these avenues.
You said prevention, and yes, that if we could prevent it, and that's a lot of what our conversation in our last segment was, what can you do to prevent it? Well, one thing is to be sexually active, but that's not always possible or viable. And so we discussed other things with stimulating blood flow. I think that's the key takeaway is stimulating blood flow. That's how you keep it there. But the audience we're talking to today, we're 50 plus, 60 or more. And more likely than not, the damage has been done and you need a way to reverse it. And that's what, today's topic really is all about. Please leave us your comments and questions like you did last time. This way we can address what you really want to know, because I understand that there are very few resources out there where you can be this blunt or ask these kinds of questions. Lana, is there anything else you want to add before we wrap this up?
I want to respond to that gentleman, and I'm so glad he commented on your page, felt comfortable too, because just because someone drinks I'll just use this, a lot of water. People always
Yeah.
talk about, oh, drink water for your skin. You could drink a recommended amount of water and you
Hmm.
still have skin that's crepey and
Yeah.
that's sagging. So you still need to hydrate your skin. So someone who's healthy and a fitness
Hmm.
expert, they're working out their body,
Yeah.
it's not affecting, it's not helping her vagina and her vulva.
Right.
So she will eventually have those same issues. So we need to blood flow. You get it from exercise, and maybe that's what he's thinking about. But if you don't have another way to get blood flow by penetrative sex
Hmm.
there,
Yeah.
then you need to have something that's stimulating blood
Yeah.
flow. And
Yeah.
really, the CO2 left is doing that.
Yeah. We'll obviously link to all of your information so, everybody can check it out for themselves and see what it's about. I know you have a great support team that can explain, these questions, and you can openly ask these questions, which is, the biggest deterrent to getting this kind of information. So Lana, thank you very much. I'm so glad you were here. Look forward to more conversations with you, and we'll see you again soon on Second Act TV.
Thank you so much. Thanks, Silka.
If you haven't done so already, please be sure to subscribe to our channel. The button is right over here. Just click on through to YouTube, and when you see the little bell right next to the subscribe button, hit that too. We'll notify you every time we launch a new video. See you next time.